Hi, I'm Topher, and I hereby volunteer to be infected with the coronavirus.
What? Are you insane? Do you have a death wish?
No, I'm just trying to help. We are helping. We're helping by staying right here on this couch.
Haven't you heard that COVID-19 kills 15% of all the people that contract it?
No, it doesn't.
Well, fine. Didn't you hear the World Health Organization when they said that it kills 3.4% of all the people that it infects?
Yes, but the data
This is serious, Topher.
serious. Yes, it is serious. But all that data, it's out of date. That's what we thought early on, but we've got much better data now.
I suppose you think you know better than the World Health Organization.
Not me personally, but the researchers that are looking into the coronavirus, they're releasing updates all the time, and their numbers are getting better and better.
Like what?
Well, take the Italian fatality rate, for example. At first, the reports were saying it was 15% or even more, but there's actually two big problems with the data. The first one is that 80 to 95% of the people that get the coronavirus actually don't have any symptoms, so they never got tested and they're not included in the data.
What difference does that make?
Well, it means that there were somewhere between 5 times and maybe as many as 19 times more infections in Italy than what we thought.
That's terrible. That's even worse.
No, it isn't. It means that instead of the fatality rate being 15%, it could actually be below 1%. We don't really know. Oh, yeah. Yeah, that makes sense. Right. Well, the other big problem with the Italian data is that they were attributing coronavirus as the cause.
COVID-19. Coronavirus is more of a generic term.
I'm pretty sure they know which coronavirus I'm talking about. They were blaming coronavirus as the cause of death every time somebody died with COVID-19 in their system.
Of course. They got COVID-19, then they died. It's pretty obvious why.
Well, no, not really. The average age of the victims in Italy was about 80, and they typically had multiple other illnesses like cancer.
Comorbidities.
What?
They're called comorbidities?
You got that off the news.
Maybe.
I'm pretty sure they know what I'm talking about.
Touchy.
My point is that most of the victims were already close to the average age of death and already had other things that were trying to kill them. Just because they died with the coronavirus in their system
COVID-19
doesn't mean that it was COVID-19 that killed them. At least a portion of the deaths attributed to COVID-19 actually should be counted against heart disease or strokes or cancer or the common cold, not from the coronavirus.
Stop it. Well, what difference does it make anyway? So what if the death rate is 15% or 3.4% or whatever? It's still super deadly and super serious.
It is serious. I said that already, but we're making really big decisions based on some pretty bad data.
Decisions like what?
Well, decisions like making everyone stay home, shutting down businesses, borders, the economy.
You can't compare people's lives with money. People are dying and you're sitting here worried about the economy? Come on.
But the economy is people's lives. Those numbers, they're not abstract numbers that have no relationship with reality. They actually represent our quality of life. When the GDP goes down, that means that we've all gotten poorer and life has gotten harder.
Doesn't seem too hard to me.
Because you're rich and privileged enough to be able to sit on a couch and drink beers for a couple of weeks. Not everyone's that lucky. When the GDP shrinks, people go bankrupt, lose jobs, lose homes, lose hope. And that's just the lucky ones in rich countries. What about developing countries? When they have a recession, when their GDP shrinks, they don't go bankrupt, they go hungry. Every recession has a death toll attached to it. And if this goes on for long enough and gets bad enough, thousands, if not tens of thousands of people are going to die from the recession, not from the virus.
Wow. You can talk really fast.
The point is that we need to know the accurate death rate from COVID-19 so that we can calibrate an appropriate policy response that doesn't cause undue misery or even death.
It kind of sounds like you're not taking this seriously enough.
This is serious! But someone dying from COVID-19 is no more tragic than someone dying from malnutrition, someone dying from depression, or someone dying from increased crime due to the recession, and we need to take all of that into account. That's why we need the best possible data on the death rate from COVID-19.
But fine. What does your precious data tell you? How deadly is it?
Well, the best data we have is coming out of Germany, where they're doing widespread public random testing. If we only test the people that have symptoms, well, that means we miss the 80 to 95% of cases where people don't actually have symptoms. Germany, South Korea, and a bunch of other countries have been doing much more widespread testing. They're showing case fatality rates below 1%.
That's still an awful lot of dead people.
It is, and this is serious. But 1% is very different to 3.4% and a far cry from the 15% that we thought we might have been facing early on. And that 1%, we know that's actually still an overestimate because so many people are missing from the data. According to the Centre for Evidence-Based Medicine at the University of Oxford, their best estimate to the overall infection fatality rate is 0.2%.
No, that can't be right. The guy on the news said that this was super deadly and super serious. Besides, you're just some dude on the internet. Why would I even listen to you?
Whoa, it's Oxford effing University that said 0.2%, not me. And besides, we know that the other data on the news is already wrong. So pick your poison. Do you want to go with the best, most up-to-date data that may turn out to be wrong? Or do you want to stick with the old, out-of-date data that you already know is wrong?
I like it better when the experts just tell me what to think.
You want an expert? Well, fine. How about John Ioannidis? He's one of the world's leading experts on epidemiology and statistics. One of the most cited scientists in the world. Probably the most qualified person on the planet to comment on the statistics around an epidemic. He released an op-ed just over a week ago in which he basically said, hold on guys, maybe we shouldn't be making such big decisions based on data we know is bad. But no one listened to him. Governments reacted to the scary data and out came the ban hammer. Sports, banned. Travel, banned. Restaurants, banned. Parties, banned. Weddings, banned. Funerals. In Australia, we can't even have more than 10 people at a funeral. Banned. Going out to the pub with your mates, banned. We have new and better data coming out every single day and it's like no one wants to listen. No one wants to actually hear the good news that the coronavirus is not actually as bad as we feared that it might have been in the beginning.
But it is serious, isn't it?
Yes, it is serious. I've said that 5 times.
Oh yeah. So why would you volunteer to be infected with it if it's a 5 on the seriosometer?
Because that's how we kill it.
We kill it by infecting people with it?
Yes. No, sort of. The way you kill a pandemic is by getting the transmission rate below 1.
It's called the R0. Just saying.
I think they know what I'm talking about. We need the R0 to drop below 1, which means that each infected person infects 1 or less other people on average. Left to its own devices, COVID-19 has an R0 rate of about 2.5, which means that on average, 1 infected person infects 2.5 other people. That's not super infectious, but it is enough that if left to its own devices, COVID-19 would just slowly roll its way through the population, and even with a case fatality rate of only 0.2%, that would still add up to millions of dead people.
Exactly, so why would you want to spread it to yourself?
Because that 0.2% fatality rate is the average across the entire population, but it's far lower than that if you're young and healthy, and it's far higher than that if you're older, or especially if you have some pre-existing health conditions.
Comorbidities?
Yes, comorbidities. And that's why I want to help out by getting the coronavirus as quickly as possible.
How does you getting the virus help?
Herd immunity. Think about that R0 number. At the moment, it's about 2.5 in a population with no immunity. But if 50% of the population were immune, that R0 number would effectively become 1.25. If 75% of the population is immune, that R number drops below 1 and the infection dies out.
But if you get the virus, you're going to have to be quarantined.
We already are. But here's the best bit. Once that quarantine is over and we've been given the all clear, we get to go back to normal life. We can go back to playing sport, traveling, going to restaurants, going to the pub with our friends, going to work.
See? Back to work. Well, see, I knew this was a bad idea.
We can get our economy back on track, stave off a deadly depression and kill the coronavirus at the same time. Just imagine if every healthy person under 40 could volunteer. They get a small payment of a few $1,000s to help cover the costs of quarantine, the lost income, the cost of getting food delivered, getting beer delivered.
Thousands of dollars worth of beer delivered. Keep talking.
And because it's all people who are young and healthy, only a very small percentage of us would actually end up needing any kind of medical help, a doctor or much less a hospital. So there wouldn't be much burden on the health system either.
How many would die?
Hard to say, but if we're all under 40, no comorbidities, then it's going to be a very, very small number and far less than would die if we enter a deep depression.
Some of you may die, but that is a risk I'm willing to take. I've already put my hand up to do it. I'll do it first if you like. You know that a plan like this is going to save thousands, maybe hundreds of thousands, maybe millions of lives. And as a bonus, it means that we're all going to have some level of immunity against the next coronavirus epidemic.
You mean COVID-20?
Yeah, sure, why not? My name is Topher, and I hereby volunteer to be infected with the coronavirus.
Yeah, all right.
Me too, but only if there's beer delivery. Corona?